Hello, this is Dr. Michael Weber from the European Laser Academy. These days, all of us are discussing COVID-19 disease, the new coronavirus CoV-2 that spread from Wuhan, 11 million capital in China, through all over the world. All continents in the world are suffering from this disease by now. Many different treatment protocols have been suggested, including malaria substances like chloroquine, which of course is primarily an off-label use. Other substances like antiviral medications have been suggested. High doses vitamin C infusions have been conducted in Wuhan and other capitals. We'd like to introduce a novel method, a forgotten method, that is in use partly already in medicine, in transfusion medicine for a long time, what we call photodynamic therapy or antimicrobial photodynamic therapy. This means the use of a so-called photosensitizer, such as riboflavin, vitamin B2, or curcumin in the combination with the absorption peak of the suggested photosensitizer. So, meaningly in riboflavin and curcumin, the main absorption peak is in the area of 450 nanometers, and this is clear blue light. Why could this be a novel approach, probably a breakthrough for the treatment of COVID-19 and other virus infections? Lots of research has been published over the last 20 decades about the combination of photosensitizers and the corresponding colors of laser light. In transfusion medicine, in Germany and 17 other countries, the blood samples are incubated by riboflavin, and then the transfusion box are put into a irradiation box where they get irradiated with UV light or blue light. Is it an effective approach? Well, the scientists, the biologist, the infectiologist, of course, can never claim 100% effectiveness. There is a specific logarithm to talk about the effectiveness. And in this approach of treatment, they found out that a 5-log reduction of virus load can be achieved by incubating the transfusion products with riboflavin and irradiating with UV light afterwards. What does it mean? A reduction of viruses and fungal substances and bacteria by 99.999%. So it's very close to 100%. We propose that we can achieve a similar result in the living body, in the human. The University of Marburg has conducted circulating models in which they could prove that this is a highly beneficial method, a highly effective method for almost irradiating all virus load in the circulating model. We have publications on the use of photosensitizers and laser, PDT, photodynamic therapy, for the treatment of Lyme's disease, the infection by Borrelia. We have some research about treatment of hepatitis by this approach. We propose, if we give intravenous a high dose of the non-toxic substance vitamin B2 riboflavin and irradiate through the bloodstream afterwards by UV light and blue light, this will highly significantly reduce the virus load and maybe at the best eradicate the virus totally from the bloodstream. And of course, if this proves to be efficient in this disease, we most likely will have a terrific treatment protocol for any virus infection, for any bacterial infection, for fungal infection, for parasites in the bloodstream. There is no resistance towards the photodynamic therapy. Another substance that could be suggested is curcumin, which has a similar absorption peak. Main absorption peak 447, so 450 nanometers, clear blue light as well. We have some preliminary results from patients treated by oral mouthwash with curcumin and afterwards irradiating the oral cavity, the mouth, with blue light. Highly significantly improvement of clinical parameters. We advise to combine PDT, photodynamic therapy, with antimicrobial functional medicine. One of the substances that had been suggested and tested and proven to be effective is the infusion of highly available vitamin C. Wuhan used 40 gram infusions. So usually recommendations for prevention would be a couple of hundred of milligram. But in these studies they used 40 gram. We suggest a minimum of 30 gram infusion. We strictly advise to combine it with anti-inflammatory substances like zinc. Zinc has proven in many studies to be effective in infectious diseases. Zinc is part of our natural defense system, the so-called SOD, the superoxide dismutase. There are 3 forms of SOD in our body. One of the important forms is zinc dependent, the other copper and manganese dependent. And this is the next suggestion: combine it with low-dose copper in addition. Copper is another form of the SOD, copper-dependent SOD, superoxide dismutase, and copper had proven to have antivirus infections as well. We will conduct studies in many countries all over the world, and we will keep you informed, hopefully within the next couple of weeks, about the treatment results in this approach. So to summarize, we have 2 or 3 pillars. First, functional medicine, antimicrobial functional medicine, namely the use of vitamin C, copper and zinc, probably vitamin D as well. Secondary, photobiomodulation by the use of curcumin, riboflavin, UV light and blue light. And third pillar, the photobiomodulation on its own. Intravenous green light laser enhances the oxygenation, the uptake of oxygen. Intravenous red light enhances the ATP production. Within the mitochondria, we have the respiratory chain, the inner breathing, the oxidative phosphorylation. And by irradiation with red light, we enhance ATP production. In example, irradiation of yeast cells have shown an increase of ATP production by 150% within half an hour. And organs containing more mitochondria produce up to 400% more ATP, adenosine triphosphate, by this method. So to give you the final result would be first pillar, the antimicrobial functional medicine, zinc, copper, vitamin C, and probably vitamin D3. Second pillar, photobiomodulation by the use of riboflavin, curcumin, UV light, and blue light. And finally, third pillar, photobiomodulation on its own by the use of intravenous red light and green light. This new approach may change the medical world. Stay informed, keep yourself informed. We will keep you informed. We are looking forward to bringing new results to you rather soon. Your Michael Weber, in collaboration with the Department for Pharmacology of the University in Marburg, namely Matthias Wojciak and Professor Bakowski. Very best wishes, your Michael Weber, European Laser Academy.